Imagine the scenario if you would. For years you've had a tricky shoulder. It pops and cracks as you move your arm in certain ways, and it's always achy when you wake up in the morning. You've blamed it on your pillow for years, but now you think it might be serious enough to seek medical help. Well, that help is here now in orthopedic surgeon Dr. Miguel Ramirez. Welcome to Living Well.
Thank you for having me.
Now, you are a fellowship-trained orthopedic surgeon specializing in elbows and shoulders. And everybody knows somebody that's got one or two issues with one or two of those joints.
Absolutely.
Where do you begin? How does somebody know if it's arthritic or something else?
Well, usually most people have different types of shoulder pain, and many times you'd have to depend on the age. So a young person that has an achy shoulder after throwing a baseball usually is not arthritis. We're talking about usually a tendonitis or something along those lines. When somebody's once you get into your 40s and 50s and you start being the weekend warriors, we see the rotator cuff tears. But usually arthritic conditions we don't see until the elderly, 60s, 70s, or people that have had either surgery or trauma usually causes that.
Got it. And what is it about the aging process that makes a joint arthritic?
We don't know, actually. There's a few things that can that are associated with it. One of them is trauma. So if you've had an injury before, that causes inflammation and degrades the cartilage in the joints. There are people that are genetic, hereditary. There's people say, well, you've probably heard people saying arthritis just runs in my family. So there's a lot of people that have arthritis even early on, 40s and 50s, without any kind of an injury. So we really don't know exactly what causes the arthritis. It's either an injury or sometimes genetic predisposition that causes you to degenerate your shoulder more sooner than other people.
So what are the symptoms that are associated with arthritis in your shoulder or your elbow?
Yeah, it's usually a nagging pain, and it's usually progresses with activity. So you wake up, your shoulder's a little bit stiff, and usually gets better throughout the day, but towards the end of the day, especially at night, it causes you pain. As your arthritis progresses, you start feeling cracking and popping into the shoulder, and eventually, as it progresses to the ultimate stages, you start losing range of motion. So people have difficulty putting on their coats, reaching up to the shelf, things like that.
Okay.
You start noticing that.
So we hear a lot about knees and hips as people age, but shoulder surgery isn't quite as common. What can people expect if surgery is in their future?
Yeah, so you hear a lot about knees and hip replacements. So many times when I talk about shoulder replacements, people ask me, do you replace shoulders? And you do, and it's at a smaller number than hips and knees because we don't walk on our shoulders, but it's relatively common. In our practice, we do about 150 a year, so it's there's a pretty decent number out there. The recovery is actually not as bad as people think. Usually, it's you can either be an outpatient surgery or people stay up in the hospital for usually a day.
So that's not much.
Not much. They usually go home the next day. Right away, they're able to use their arms for waist-level activities. So right away, they can write, type, eat, brush their teeth, wash their face, all of those things out of their sling.
And can they go back to full activity?
Yes. So
after the recovery period, of course.
Usually about 3 months. At 3 months, I let my patients go back to all activities. I tell them pretty much anything that a reasonable person can do, you should be able to do. So sports, gardening, golf, whatever you want to do, you should be able to do afterwards.
Dr. Miguel Ramirez, some great information. Thank you very much.
Thank you for having me.